everyone. I'm Sonali Singh, a pediatric neurologist and member of ICNA and FLICNA. And it's my pleasure today to interview Dr. Michaela Waak, who's a clinician, a researcher, and an academician. She's an eminent pediatric intensivist and neurologist from Queensland Children's Hospital, Australia. And today, I am interviewing her because she is one of the coordinators for the Neurointensive Care Workshop, which is going to be held in the upcoming ICNC 2024. And it's on 6th of May in the beautiful town of Cape Town in South Africa. So welcome, Dr. Michaela. I do have certain questions for you.
Thank you. Thank you for the kind introduction.
Thank you so much. So to begin with, we'd like to know about your place of work. And it'll be very interesting to know how you developed interest in your field.
Thank you. I trained in Europe initially and then actually had some training in Cape Town, which I'll talk a little bit more about later. And then when I was completing my fellowship in pediatric ICU after I'd done general pediatrics and pediatric neurology, moved to Australia in Brisbane, initially expecting only to go over for a fellowship. But since my family and I have settled here, because the work-life balance and the ability to conduct research and make an impact have really excited us. During my training, what really impacted on me was how in certain circumstances in the very acute phase, we can make a huge impact on patient outcomes. And neurocritical care is a very emerging field where quality improvement and research in our clinical practice change and can be improved quite drastically. I then met other enthusiasts that some of them are dual trained as well. For example, Dr. Christine Gurlims, who's the PNCRG chair. And since then, we've really tried to develop local and national as well as international collaboratives. So it's extraordinarily exciting to be able to collaborate at the ICNA.
Yeah, that's actually a very inspiring thing. So my next question to you is, what does ICNA mean to you?
So when I initially joined the ICNA, what I found extraordinary is its reach. It doesn't really matter which setting or which country or location you work in. You'll find colleagues that are interested in making an impact on patients and working together as a team. And I'm an extrovert. I really like the team sport side of things. So being able to connect with colleagues so freely and being able to tap into the resources that are developed and knowing that you're not alone makes a huge difference. I really, really love that about the ICNA. And I've met amazing colleagues and friends.
Yeah, hopefully I'll meet you this upcoming ICNA. So my next question to you is, what is the one thing or maybe two things that you're looking forward to when you attend ICNC 2024?
I can't wait to catch up with my colleagues, and I also can't wait to go back to Cape Town. I actually completed my internship in Cape Town at the Red Cross Children's, and I've not been back since 2005. So yeah, I'm extraordinarily excited. And when you think about what advances have been made in Cape Town, and yeah, just being able to gather together, regroup, see what other people are developing and up to and learning.
Yeah. So regarding the neurointensive care workshop, why do you feel the theme of this workshop is so important?
We have an amazing group of faculty. So we've now actually have 10 faculty join us. That's international, and that offers an extraordinarily expertise. The format's going to be small group sessions. So we kept the number of candidates at 50 and we'll split up in 4 groups. So each candidate will have access to not just the colleagues in their group, but also the faculty members. And we're really hoping that in some emerging fields like pediatric stroke, the autoimmune encephalitis, there's epilepticus, and other relevant neurocritical care issues where there have been developments over the last couple of years, we'll be able to talk together and come up with some universal approaches to patients that might really help. And we also have now have a neuromuscular specialist join us to teach us about the floppy week children and neuromuscular emergencies, which is very exciting as well.
Thank you so much. Actually, you answered my question, which I was about to ask you next, that also. So my last question for you will be, what message or what would you like to say to attendees of this workshop?
Expect a very collegial atmosphere. Bring all your knowledge and all your questions. Share how you approach things in your settings, because the way we look at it is that it's always give and take. And we as faculty expect to learn as much from the candidates as they learn from each other and from the faculty. And we're hoping that if this is successful, that it might be able to be an evolving and ongoing initiative that we can share more over time.
Thank you so much. This really sounds very interesting, and I'm sure all the attendees who are going to be part of this workshop, they're going to benefit a lot. So those were the questions from my side. And thank you so much.
That's wonderful, Sonali. So what the last thing I wanted to say, that it is very much aimed at the pediatric neurologist. So it's not necessarily for fellows or trainees, but it's really kind of focusing on the cold face of you're on call and a child comes in that might be experiencing a stroke, or you have to see a floppy week infant and it's late and you can't really call for help straight away. So yeah, really excited.
I guess this is something which pediatric neurologists we actually face. I mean, I'm sure everybody is going to relate to it and definitely knows the need of this workshop. So thank you so much, Dr. Michaela, and we are looking forward to meeting you and to attend this workshop. Thank you so much.
Thank you. Bye-bye.